What are the options for scoliosis treatment, and what are the alternatives to surgery? Unfortunately, scoliosis can be a common condition. The current estimates that it can affect over 7 million people in the United States could be living with scoliosis. And we know scoliosis is the leading spinal condition among school-age children. Awareness to the different treatment options is something I consider very important because most patients don't realize that there's many different options when it comes to treating scoliosis. And even some doctors and physicians that are seeing patients with scoliosis don't know all the options. And there's two specific ways that scoliosis is actually treated. And I like to look at this as the main treatment options that the people choose between is something called traditional scoliosis treatment options, which typically offer a surgical response once curves become severe enough or cause enough pain or discomfort to a patient that they would consider a surgical option. And then I like to also call it a modern conservative scoliosis treatment program that offers non-surgical treatment as an alternative to surgery. Now, when we look at scoliosis surgery, it involves spinal fusion. And this involves fusing the most tilted vertebra together with the most tilted vertebra on the bottom of that curve and fusing the entire area of that curvature into one solid bone. And in most cases that this involves removing the intervertebral discs. It means removing the posterior aspects of the vertebrae using rods and screws and fusing that area together. Now, if the person has two curvatures, this fusion can be much more extensive. It can expand 13 vertebra, and commonly these rods are attached to the spine and through pedicle screws, and they're trying to hold it in place while they use bone grafts in between every vertebra where they move the intervertebral disc to hold it in place so the bone grafts can take place, and then there is actually bony fusion. So it comes a point that the rods are no longer holding the spine, they're still implanted, but the spine is actually fused together with bony grafts because the intervertebral discs were removed. Now, we know spinal fusion is a risky, invasive, lengthy, and costly procedure. And fusing the spine is really contrary to the spine's natural design, which is designed to be a very functional movement-based structure. So the effect of this type of fusion is really unknown on a long-term basis for overall health and function. If a spine is fused, we know it's definitely more vulnerable to injury, meaning these rods and screws can be dislodged and displaced. We also know the bone grafts may not take, which can lead to weakness in those areas. And we know a fused spine can also lead to pain because the spine becomes more rigid. And as that area becomes more rigid, we know the surrounding muscles and tissues are affected because there's something foreign in the body. And it's also displacing forces above and below the fusion, which can lead to other problems. Unfortunately, many patients are disappointed with the loss of spinal flexibility post-spinal fusion, and this loss of range of motion and what they're left with is something that can't be reversed because it is embedded in the structure of the spine now because there's rods and screws and bone grafts holding in place. These risks, not only these things must be considered, but there's risks associated with the procedure itself, like infection, nerve damage, adverse reaction to the hardware, excessive blood loss, and so forth. So even though spinal fusion can make the scoliosis straighter, it does it at an exchange for spinal function. So scoliosis fusion is a non-functional approach. It is trying to improve alignment for an exchange for function. Now, a non-surgical treatment is trying to reduce the scoliosis curvature while not causing fusion. So it's trying to maintain the spinal flexibility and motion that's associated with the scoliosis and the spine, and trying to reduce the curvature by combining multiple condition-specific treatment disciplines that have an impact on the curvature on a structural level. Now, this can include many different things depending on the case and the unique presentation, but generally it tends to have many different components, things like chiropractic care that work on adjusting the spine in a structural basis to get the spine aligned with the rest of the spine. So therefore, therefore there's a better motion and mobility and less nerve pressure involved. There could be physical therapy and scoliosis-specific exercises that can be done to help work the spine's strength and stability in an asymmetrical manner to help move the spine into a straighter position. There could be corrective bracing that's particularly effective on patients that are growing, but it can be used in any age patient because it's used in a corrective manner to help reduce the spinal curvature and improve the shape of the torso and help mold the body. We also have office rehabilitation and home therapy that can be used specifically for scoliosis patients. And these are normally asymmetrical exercises and therapies that can be used to help mobilize and move the spine into a lesser of a scoliosis position. Now, we know non-surgical treatment can have a very positive effect on the body because since conservative treatment is non-invasive, we always know that it's not a lifelong thing that's happening, meaning if conservative treatment is unsuccessful, we can always consider more invasive treatment. But once invasive treatment is performed, like spinal fusion, there's very little things you can do post-spinal fusion because the invasiveness of the treatment stops any further treatment from being effective. Conservative treatment also complements the spine's natural movement base. So what we're trying to do is keep the function of the spine the same while trying to reduce the scoliosis. And this is the best benefit because while you maintain spinal function and reduce the curvature, we know that now you're getting the best of both things. Conservative treatment also protects the integrity of the spine since there's no rods and screws, and no surgeries, no discs that are being removed, no bones is being removed. We know the spine itself remains in its most natural state. In addition, since most patients are growing with scoliosis, you have to understand they're growing around the curve and everything in their body is adapting to the scoliosis as they grow and develop. And most patients are treated once they've already gone through a significant amount of growth and the curve is already there. And even if we were able to move the spine completely, say back into a perfectly straight position, the rest of the body still grew with the scoliosis. So therefore, it's used to having some curve. Therefore, like they could have asymmetrical pelvis, legs, shoulders, clavicles, skull, jaw. They can have bones and muscles and tissues that have adapted to the scoliosis because they've grown this way. And a lot of times surgical intervention is just dealing with the spine and not really dealing with anything else. It can lead to complicating factors. And in fact, they're limited in how straight they can make the spine because of this very thing. So therefore, with conservative treatment, we're never going to be able to reduce the curve beyond the body's ability to accept it. So most cases, the body will stop any reduction that would be negative to that person, which is unique to that person. So we know when a patient is diagnosed with scoliosis, how they respond to that diagnosis can really impact long-term health and well-being. While surgical treatment may have the quickest, fastest way to reduce the size of curvature, it does it at an expense. And the expense is something that we call spinal function. And this non-functional approach may reduce the size of curve, but could lead to a whole other host of issues and concerns that may occur very quickly after spinal surgery or could be delayed 20, 30, 40 years later. Here at the Scoliosis Reduction Center, we really address scoliosis proactively by using a modern conservative treatment program that involves combining many treatments, but most importantly, it combines treatments to retain spinal function while we're reducing the scoliosis and not jeopardizing this long-term health and well-being of the spine that could be affected with scoliosis surgery. Thanks for watching. I hope you found this information helpful. If you'd like to hear about other topics and information on scoliosis, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish content. Thanks.